Martinsburg is great. It really is.
Kind of a blue-collar working man's city.
But we've been hit really, really hard. With opioids especially.
Probably in 2016, really saw, unfortunately, a lot of patients who were presenting to the emergency room who were overdosing and had opioid use disorder.
It's pretty standard that I'll see 1 or 2 people a day in my shift that are at least dealing in some way with opioids. We were seeing at times 2 or 3 overdose deaths a day.
Some of our medical staff and our healthcare workers, our nursing staff, had perceptions and were getting a little hardened.
When you see that repeatedly, especially if these are patients that maybe you had seen 2 weeks before, after having revived them from an overdose, it really does it's impactful.
There was no demographic to it. I mean, it was all races, all ages.
When you look at the number of patients that you see coming in needing these types of services, we owe it to our community to be able to answer those needs.
And that's when I decided, you know, there's got to be something I can do. Recovery Coach program. It's all about the community coming in and being part of the treatment of a problem that we thought that we could handle it medically on our own. It's not the way it is.
The recovery coach to me is almost a safe person who's not a medical care provider. They're there to talk about them, to say, what can we help for you to get through tomorrow and the next day.
I realized I'd been part of the problem for so long. I wanted to be part of the solution.
And I had something that no one else had. You know, I had 30 years of chaotic substance abuse.
We just are there to kind of help support, encourage, and educate the person about multiple pathways to recovery.
Being able to talk to a person to where you're a help and not a hindrance is what recovery coaching is all about.
Been working since I was 13 years old, so I've worked construction and landscape for 37 years. My body is broke up. I was prescribed painkillers and was addicted to them. And when they ran out from prescriptions, heroin was a lot cheaper. I got up in the morning, usually did the dope that I had to get going, and the rest of the day was spent on getting more. I had enough. So they had asked me if I wanted a recovery coach, and I said, sure.
I was volunteering at the hospital as a recovery coach, and I saw Robert in the bed, and you could just tell in his eyes he was done.
She came, did stuff for me like what a mother should do, you know. Really sincerely cared.
I think it was pretty much right off the bat that I shared part of my story with him. And I do think that created a bit of a sense of security that, okay, she's been here, she's done that. And I think that kind of helped maybe release his guard a little bit that, okay, she is a safe space, I can trust her.
We told him that we would be with him until he'd get it straight, you know, he'd get it right, if that's what he wanted.
I couldn't believe that someone would do that for me.
Robert, I think, is the best example of why recovery coaches should be in the hospital. Seeing him where he is now, just such a zest for life has come back. It's really night and day.
The more that you engage with people in recovery, the more you know that this is curable. You know that this is treatable. You know that we can change the tide on this, absolutely, for all addiction, not just opiates.
There's people out there that are dying, that need help. And that's how they can get it.